Medicare doesn't make any sense. So again, we're here to make this as simple as 1, 2, 3. So on a previous video, we talked about the 3 enrollment periods for Medicare. The initial 7-month initial enrollment period, the SEP, the special enrollment period, and the general enrollment period, the GEP. So I'd recommend to watch that video again if you've not done it yet, or to get reacclimated to the Medicare enrollment period, because right now what we're going to do is we're going to talk about the Medicare Advantage enrollment period, which is very different than Medicare enrollment and the initial, the special enrollment and the general enrollment period. So we're going to talk about the Medicare Advantage enrollment period. So remember, we're talking now about Part C of Medicare, which is like Medicare A and B, but it's provided through a private insurance company instead of through the federal government. So once an individual is enrolled into Medicare Part A and Part B, they will have the option to enroll into an alternative plan like an HMO or a PPO through a private insurance company. Medicare Advantage Part C plans will have annual contracts with that private insurance company since they're an alternative to Medicare A and B. So an individual who wants to join or make changes to their Medicare Advantage Part C plan will need to be aware of 2 annual enrollment periods that are available to them every single year. These enrollment periods are constant and they do not change. So let's go over those right now so that you understand both enrollment periods. So here are the 2 Medicare Advantage enrollment periods. There's only 2 enrollment periods that happen every year like clockwork that are primarily dedicated to Medicare Advantage Part C plans. These 2 enrollment periods occur like clockwork. As I mentioned, they're available to someone that's already in Medicare system. I want to make that very, very clear. So the very first enrollment period for Medicare is called for the Medicare Advantage is called the Medicare Open Enrollment Period. A lot of people will also call it the Annual Enrollment Period. But again, it happens every year between October 15th and December 7th. The second enrollment period is the Medicare Advantage Open Enrollment Period, which we're going to discuss right now in a second, which is between January 1st and March 31st. So let's jump into that right now. So let's talk about the very first one, which is very, very popular every year. The Medicare Open Enrollment Period occurs between October 15th and December 7th. Medicare recently started to refer to this period as the Open Enrollment Period, OEP. If you hear it called the Annual Enrollment Period, AEP, which is what is commonly referred to previously, these are both the exact same enrollment periods. Again, this is where Medicare just doesn't make any sense sometimes on how they actually decide to word things. This is another reason why looking at the different options that Medicare can offer can be very, very confusing. Again, if you're confused by all of this, please give us a call here at Healthcare Solutions Direct. That's our goal, is to make this simple as 1, 2, 3. Be sure to watch this video again so you have a very clear understanding of the Medicare Open Enrollment Period, which is often called the Medicare Annual Enrollment Period, as well as we're going to talk about the Medicare Advantage Open Enrollment Period. Again, sometimes those seem tongue-tied when you go through them. But Medigap supplement plans, here's where things don't make any sense. Medigap supplement plans also have an enrollment period called the Open Enrollment Period, OEP. This period is typically only available once during someone's lifetime. That has nothing to do with this annual enrollment period. So we'll talk about that more when we talk about Medigap supplement plans in those videos. So let's talk right now and focus on the Medicare Open Enrollment Period that occurs every single year. So again, the Medicare Open Enrollment Period, OEP, always runs from October 15th through December 7th. So during this period, an individual can join or make changes to their annual contracts for the next calendar year with the Medicare Advantage private insurance company. So any changes or decisions that are made during the Medicare Open Enrollment Period, OEP, will take effect on January 1st. So someone must be enrolled already in Medicare Part A and Part B in order to participate during this enrollment period. So let's talk about this, because this is a very big confusion we'll talk about a lot during the Medigap supplement videos as well as the Medicare Advantage videos. But Medigap supplement plans do not participate during this open enrollment period. They're not bound to the open enrollment period. So the reason is because Medigap supplement plans are a direct extension as a secondary insurance to Medicare Part A and Part B. So original Medicare Part A and Part B does not have an annual contract that comes with it, because this is the only option that's available that's run by the federal government. So let me repeat that again. Original Medicare Part A and B. Once you go ahead and sign up for Medicare Part A and Part B, there's no annual contract. You don't have to keep doing it, because that's the only option that's available through the federal government. Medicare Advantage Part C plans, on the other hand, are run by private insurance companies that have several different options available to them that are actually annual contracts away from the federal government. So here's what someone can do during the OEP every single year. So during the open enrollment OEP that runs from, again, October 15th through December 7th, I keep repeating that, an individual can make the following change or decisions to their coverage. So number one, they can change to a Medicare Advantage plan from original Medicare. So again, if you have original Medicare A and B, you can purchase or change to a Medicare Advantage plan between October 15th and December 7th. It would start on January 1st for you. Number two, you can change to original Medicare from a Medicare Advantage plan. So if you're in a current contract with a Medicare Advantage plan during October 15th through December 7th, you can now switch back to original Medicare as your insurance for January 1st. Number three, you can change from one Medicare Advantage plan to another, regardless whether they offer drug coverage or not. So again, if you're in a Medicare Advantage plan currently, you can switch to a different Medicare Advantage plan during this time for a January 1st start date, regardless if that new plan or the current plan includes prescription drug coverage or if it doesn't. The last one, number four, is you can enroll in or drop a standalone PDP prescription drug plan. So if for some reason you do not have credible prescription drug coverage currently, you can now purchase a Part D drug plan during this time period of October 15th through December 7th, or you can also change your Part D drug plan around as well for January 1st. So be sure to get to know those four options that you have during the open enrollment period with Medicare. Maybe rewind this so you can go ahead and listen to it again so you really understand these four options during your Medicare open enrollment period. So if an individual would like to enroll into a Medicare Advantage plan during the open enrollment period, during this OEP between October 15th through December 7th, here are the only two requirements that you need in order to go ahead and apply for a Medicare Advantage plan. The individual must be enrolled in both Medicare Part A and Part B. We talked about this before. You have to have the foundation of Medicare. You have to have Medicare A and B in order to go ahead and choose an alternative plan to original Medicare. So you have to have Medicare A and B in order to be able to go ahead and enroll into a Medicare Advantage plan. Number two, that person must live within the plan's service area or network in order to go ahead and enroll into that plan. So what to do during the open enrollment period if you're happy with the coverage that you currently have. So if you're happy with the coverage that you currently have right now, if the individual currently has an MA or an MAPD or a PDP plan that's still available in that area and they don't want to make any changes during the Medicare open enrollment period OEP that occurs between October 15th and December 7th, there's nothing that you need to do. The coverage will automatically renew for the next calendar year at midnight on December 7th. The individual will be able to continue to use their current insurance card. So again, if your current insurance right now is still available for the next calendar year, whether it be an MAPD, MA, or a PDP plan, you're happy with it, you don't need to do anything at all. On December 7th, that will go ahead and automatically roll over for January 1st, and you can still continue to use your current card right now. You don't have to wait for a new one. They more than likely will not mail you out a new one as well. So what to do if the current coverage is not available. So if the individual's Medicare Advantage plan is not available for the next calendar year, they will receive a notice before the beginning of the Medicare open enrollment period. So if for some reason your PDP plan or your MAPD plan is not available for the next calendar year, by law, that company is required to send you out a notice before the Medicare open enrollment period letting you know that they will not be available for the next calendar year. So the individual will want to select another Medicare Advantage plan during this period so that they'll have coverage for January 1st. If the individual does not select a new plan, they will go back to original Medicare Part A and B as of January 1st. Let me repeat that. If your Medicare Advantage plan is no longer available for the next calendar year, during the Medicare open enrollment period, if you do not make any changes to that, you don't change to a different plan, on January 1st, you will revert back to Medicare A and B as your insurance. So if the individual did not select a new plan during the Medicare enrollment period OEP, they will still have an opportunity to do so when that coverage ends on January 1st. We talked about the 63-day SEP rule in a different video. The individual can use the 63-day SEP available to them because the coverage ended involuntarily. So you would have 63 days after January 1st to be able to go get another Medicare Advantage plan or a PDP plan. So let's talk about the second enrollment period for Medicare Advantage plans. It's called the Medicare Advantage Open Enrollment Period. It happens between January 1st and March 31st. So the Medicare Advantage Open Enrollment Period is only available to those individuals that are already enrolled into a Medicare Advantage plan with or without drug coverage. So again, let me repeat that right now, because this is where a lot of people don't understand this. Between January 1st and March 31st, you have to already have a Medicare Advantage plan in place in order to participate during this period. Some will refer to this enrollment period as the buyer's remorse period. I think this is a good way to understand this period called the Medicare Advantage Open Enrollment Period. Some people refer to it as the buyer's remorse period. This period is set aside for those that would like to still make some changes to their current Medicare Advantage plan. So again, let's look at what can be done, and let's talk about the history right now as well of this enrollment period. So until 2019, the Medicare Advantage Open Enrollment Period was actually called the Medicare Disenrollment Period. It ran from January 1st through February 14th, which was a little shorter than the current period of January 1st through March 31st. So this new enrollment period is somewhat new to Medicare. So during the Medicare Disenrollment Period, so we're going to talk about what happened prior, during the Medicare Disenrollment Period that was available prior to 2019, the only thing someone could do with their Medicare Advantage plan was to enroll into a standalone PDP prescription drug plan. That's all that they could do. This would allow someone to get out of the contract from their current Medicare Advantage plan back to original Medicare Part A and B as their primary insurance. So that was what happened before 2019. So now, as of 2019, the Medicare Disenrollment Period was renamed the Medicare Advantage Open Enrollment Period, and it now runs from January 1st through March 31st. So now you're caught up on this enrollment period. So it's now called the Medicare Advantage Open Enrollment Period that runs between January 1st through March 31st. So this new enrollment period brought with it some very significant changes besides just a new name and extending the period to March 31st. The most significant is that an individual can now change one time to another Medicare Advantage company available to them in their area. So if someone, say, is not satisfied with their current Medicare Advantage coverage, let's say maybe a doctor's not in the network, or maybe one of the benefits is not what they thought it was going to be, they can make a change during this Medicare Advantage period. So if you are satisfied with your current coverage, you don't need to make any changes during this actual enrollment period. So let's talk about what's available during this period to someone that has a Medicare Advantage plan. So during the Medicare Advantage Open Enrollment Period, which runs every year from when? January 1st through March 31st, the individual can make any of the following changes. So there's 3 changes that they can make. The first one is this. You can change one time to a different Medicare Advantage plan with or without drug coverage. The next thing is, number 2, is you can cancel the Medicare Advantage plan and return to original Medicare A and B during this time period. And lastly, number 3, you can enroll into a standalone PDP prescription drug plan, which will cancel your current contract with the Medicare Advantage plan and return you to original Medicare Part A and Part B. Again, those are the 3 things that can be done during this enrollment period. So the new Medicare Advantage Open Enrollment Period provides someone with more options and the ability to get out of their current contract. So any changes that are made during this enrollment period will start on the 1st of the next month. So let me give you an example. If someone makes any changes to their current Medicare Advantage plan, let's say in the month of February, their current coverage will start on March 1st. It'll start on the 1st of that next month. So no changes can be made to someone's Medicare Advantage plan after that March 31st midnight deadline until that calendar year's next Medicare Open Enrollment Period, OEP, which will run from October 15th through December 7th of every single calendar year. So now you should have a better understanding of exactly the Medicare Advantage Open Enrollment Period. We went over the Medicare enrollment periods. We talked about in a previous video. We talked about the 7-month initial enrollment period. We talked about the special enrollment period, the SEP, and we talked about the general enrollment period, GEP. That was to sign up for Medicare. Then we just went over the Medicare Advantage enrollment period. So we talked about the Medicare open enrollment period, which happens every single year. You must have Medicare A and B you must be eligible for Medicare A and B in order to participate during this period, which runs between October 15th and December 7th for a January 1st start date. Then lastly, we just talked about the Medicare Advantage open enrollment period, which happens between January 1st through March 31st. During this time period, you can make any changes to your current Medicare Advantage plan. Remember, the key rule is you have to have a Medicare Advantage plan in place in order to make any changes during this last period right here. So be sure to watch this video again to be sure that you are a Medicare expert and you understand the different enrollment periods. If you have any questions about this, that's what we're here for here at Healthcare Student Direct. We are here to make this process simple as 1, 2, 3 and make sure that you have a source that you can always call and talk to about your coverage and make sure that you're doing the right thing for your situation. Thank you again.